Cases still on the rise across the country. Dr. Jen Ashton, the chief medical correspondent for ABC News, joins us now. Thank you so much, Dr. Ashton, for being here with us today. We so appreciate you.
Thanks for having me.
And I know a lot of updates this week. Early this morning, Pfizer officially submitting its vaccine data for children ages 5 to 11. A big update there. You know, we have Halloween around the corner. What is the significance of this for children really across the nation right now?
Well, I think it's going to be still a matter of watchful waiting. The FDA is not going to cut any corners based on a timeline or the calendar date when evaluating this clinical trial data. They did actually decide with Pfizer that they were going to expand the data set in this age group to make sure that there were no safety signals. In particular, they wanted to make sure they were including enough children in the clinical trial to look out for that rare inflammation of the heart muscle called myocarditis. So now that the FDA has this data, it could be a couple of weeks before they make their official decision. No one has a crystal ball here, but if everything goes smoothly and as expected / hoped for, it's possible that around Halloween we could have an official authorization, and therefore children in this 5 through 11-year-old age group could be getting their first doses of the vaccine sometime in November. But again, no one knows for sure, and this pandemic has shown us that things can happen unexpectedly. I think that's an understatement.
Oh, yes, one day at a time. And a big national story now that I have just been glued to out of New York, obviously, where this vaccine mandate is already in effect for healthcare workers, causing some to walk away from their jobs. Would you say a lot of employers, really even across the country, are kind of being put in some tense situations right now?
Well, I think this is something that's unfolding, you know, as a lot of the other news in this pandemic has unfolded, with some surprises along the way. We have to remember that there is a precedent medical legally with this type of thing. You know, at my hospital, for example, in the suburbs of New York City, I have to get tested for tuberculosis every single year to maintain my privileges on staff there. And they require influenza vaccination at my hospital. So this is not the first time we're seeing something like this. I think it's certainly the most publicized time, and we have seen slight upticks in vaccination rates as we approach the dates for some of these vaccination mandates. So I think we have to just wait and see how it unfolds. But you know, I like to stay in my lane, which is medicine and science, thankfully.
Absolutely. Before we wrap up, something I've always admired about you is you're always so vocal about this topic. And I know for September, it is, for anyone who doesn't know, Suicide Awareness Month. Kind of changing gears here, but such an important topic. And I know you actually wrote a book on it, and you have personal experience with a loved one too. Is that right?
Yeah, unfortunately, I lost my ex-husband and my children's father to death by suicide 4 years ago. So I wrote about our experience and the experience of other survivors of suicide in my book, Life After Suicide. But I think one thing that my children and I have learned, I mean, obviously we continue to learn every single day, but it's that, you know, mental illness does not discriminate. And there aren't always the classic signs that we learn about in medical school. But with over 40,000 Americans dying by suicide approximately every single year, I really think this is something we need to start talking to our children about, because unfortunately it's only a matter of time until we all know someone who dies by suicide. But the bottom line is there is always hope and help available. And even though it feels like someone is alone, they are not. And so that Suicide Prevention Lifeline, 1-800-273-TALK. I think we should start teaching our children to know that, just as they know to dial 911 in an emergency.
I could not agree more. Such an important topic. Dr. Ashton, we so appreciate you on this Tuesday morning. Take care of yourself.
Thank you so much.